alaikum. I'm here at the Middle East Medical Center with Dr. Jace Joy, and we are going to talk about dentistry and very important things that we may be suffering from on a daily basis, but we don't know how to fix it. For example, the cavities.
Yeah.
We go to the dentist and they do the fixing, but what is are there like different types of materials that you're using? I've heard also some of them sometimes causes sensitivities. Some people also suffer after doing some fixing cavities. So can you please just tell us about the cavities and how is it done? How is it fixed? How is it?
Sure, Fatima. Yeah. You see, dental cavities is a very common problem for the elderly people, especially 90% of the population they have.
I'm not old and I have cavity all the time.
No, that is the general, the data. 90% of the elderly people they are suffering from the dental cavities.
Right, yeah.
Yeah.
I think I'm getting old.
Yeah. So you asked about the reason for that. You know that dentists they always tell that brush the teeth properly, do flossing.
Yeah.
You should brush twice a day and floss once a day. And you should use some toothpaste containing fluoride.
Mm-hmm.
According to the scientific studies, it is proven that if there is fluoride in the toothpaste or mouthwash, it will protect the teeth more.
But about the brushing itself, I mean, I think we misunderstood something. Like, for example, I remember when we were children, they used to tell us, like, after you eat something sweet, brush your tooth. Is this correct, or you're actually just rubbing all of the acids and everything all over? Like, do you have to, like, kind of wait before you eat, or immediately you just brush it? So what would be a better practice?
Yeah, it's a good question, actually. Normally, we brush before eating, but there is not much benefit from that.
Okay.
It's better to brush the teeth after eating, after your breakfast, and before going to sleep, the last thing to do in the day. So that what happens, I will tell the basic, what happens when we are eating food, especially sugary food, it stays there on the teeth, we call that plaque. So in that area, the bacteria multiplies, and this bacteria make acid. This acid is damaging for the teeth. In fact, it will demineralize the enamel of the teeth, and that's how the cavity is starting.
I remember even the acids can cause also sensitivities in the tooth as well, so this can cause the problem. I remember I was using like chewable vitamins, which is like highly acidic, the vitamin C, and then brushing afterwards. Is this a bad practice, or should it be done this way or the other way? Because I think I was doing it all wrong, like having the acidic vitamin crushed all over my teeth and then brushing it and aggressively brushing it. Is it a bad practice or?
No, the power you are showing in your hand.
Yes.
How much forcefully you are
the aggressive brushing, which is a problem I think many people.
No, you should be very gentle with your teeth. After all, because if you damage the teeth, it will not replace by itself. And normally.
So can brushing damage the teeth?
Yeah, if you are doing over brushing, if you are brushing over with over pressure in the hand, it will remove the outer layer of the teeth.
So as strong as it looks.
You should be gentle.
And the bite, as strong as it is, at the end of the day, a brush can actually damage it if you're brushing wrong. You see that, people?
Yeah, brushing you should do brushing, but gently, and it should be in the small circles.
Yeah.
If you are doing like this, it will remove the enamel.
Yeah.
We call abrasion. Again, it will make more sensitivity, So it should be a medium brush, and you should make sure that you are changing the brush regularly.
How often? This is a very
depends upon how you are brushing. If you are applying more pressure, it will damage the bristles.
So when the bristles start to look
you should see how
different,
it is. Normally not more than 6 months.
Okay. So the age life for the brush is no more than 6 months. How long have you been keeping your brushes?
Nowadays there is electric brush as well. So
that
will be more useful for you.
I think there are now many brushes marketed for to avoid overbrushing, which can cause a lot of problems. A lot of people are suffering of problems because they are brushing aggressively. I'm one of them.
There is one misconception that if you are doing overbrushing, the teeth will become more white. In fact, it is initially it's like that, same like we are polishing the car, but we are removing the outer layer of the teeth. Ultimately, I have the model as well. This is the normal structure of the tooth. So we are brushing the teeth like this, but if you are damaging the enamel, then the inside of the tooth is yellow. So it will become more sensitive and it will show this yellow color. That's That's what happens.
That's why whenever I visit any dentist, they ask me if I'm a smoker or if I drink soft drinks. No. But what happens? They say, "Are you a coffee drinker?" I said, "No, I don't even like coffee." So this is basically just because I'm overbrushing.
No, in fact, your teeth are good. It's not yellowish at all. Yeah.
Thank you. Because sometimes, this overbrushing can cause these such problems that are related to color. And when we talk about sensitivities also and cavity, is it related? Are there different type of composite or whatever material that we are using to
That's
fix
the filling material.
The fillings, yeah. So
no, now we will come back to the previous question, the cavity.
Yeah.
Like if it is in the initial stage, we have classification: class 1, class 2, class 3. Class 1 is the small black dot. It is better to treat at that time. Don't wait more. So what happens if you're going?
Why is it sometimes they ask us to wait and come back?
That may be the follow-up, Every 6 months you should visit the dentist.
Yeah, I'm sure a lot of people now, they will relate to what I'm saying. Sometimes I go to the dentist and I show them, there is kind of, they say it's just a stain, you come back later or something, and then it forms and it becomes a really huge cavity, So
no, maybe that's misunderstanding. If it is only stains, it's okay, because it is not like a table. There are grooves in that. And that if there is stains, it's okay.
So does the stain become cavity later?
No,
or
stains.
it's a different kind?
It's a different. Stains may not progress with the cavity. As I told you, if the food stuck there, sticky, sugary food, then only it can lead to a cavity. Otherwise, that's what it is. The dentist can examine and they will tell you exactly what is the problem. And if composite filling like initial cavities, we can remove the cavities totally painless, and we can replace it with the tooth-colored filling material. That is composite.
Okay, and that composite, are there different types of composite or different qualities or different?
We have multiple types because we have to select the color of the teeth also. Like should be matching with your other teeth.
And are there types that can actually cause sensitivity, or is this just a misconception?
No, it will not cause sensitivity.
Because sometimes from my experience, and I think a lot of people may relate, after doing the treatment for the cavity, afterwards, I cannot even drink water because it will aggravate the...
That means that cavity has gone deep, class 3, very near to the nerve inside. So whatever it is passing direct into the nerve, that is causing the sensitivity.
And
that's why I'm telling you, don't wait. You should start
so
initially.
this is like a permanent problem, or is it fixable?
Which one?
That kind of sensitivity that comes with the cavity fillings.
Can be treated. So if it is severely sensitive, then we have to go for a treatment called root canal treatment.
So it is not the filling issue, it is just that the cavity has gone too
Another dentist can evaluate. If it required, they will take X-ray as well.
So we kind of spoke about cavities and stains and yellowish of the teeth. Are there like different kind of also treatments now to reduce the staining of the teeth?
Of course. So that I'll tell you in a simple way. We can classify the yellow color into two ways. Okay, we can call external stains. As you told, it can be from the excessive coffee, or maybe from red wine, or anything, tea, smoking, everything can cause external stains. These stains can be removed easily by brushing or using a whitening toothpaste.
Miswak, do you agree?
It's good. I like that.
Yeah,
it's the natural way of using that one.
Actually, I've tried it a few times and it's
good,
like really good.
Yeah.
But the miswak, you have to kind of, it becomes into like a brush. But you can also, is it okay to use it when it's like really hard? Sometimes just scrape off.
If it is hard, it can damage the teeth.
Okay.
But if you are using in a proper way, it's good.
In a proper way,
The main purpose of the brushing is to clean the teeth.
Yeah, why I'm asking you, because I love to use miswak, but sometimes I need to use it when it's hard to kind of like really rub off some of the stains that, really difficult to stain. So
then you should come to the dentist.
Then you don't advise with that one. We should not really play with the teeth because it can be very sensitive, as strong as it looks, So these are really important things. Thank you for sharing.
Coming back to the stains.
Yeah.
So this is for external stains. That if it is there, you can go to the dentist. They will do the cleaning. We call scaling and polishing. So they will remove the stains, external stains completely. But the second classification is the internal stains.
Yeah.
Internal stains means the stains are there since long time. It may be due to some fluorosis, excess fluoride in the water, or maybe due to some medication taken during pregnancy time, all those things can make stains from inside. So the normal cleaning, brushing, it will not help much. In that case, you have to go for treatments in office, in the clinic, like bleaching, something like that.
In general, what are, like, when you just said some few causes of the stains, now what are the other main causes of the staining?
These are the things only, and the aging also. Like the teeth will get more yellowish as the age advances.
That's the thing. So yeah, I was looking for explanation because it's,
it's
not always the food, or we cannot always blame the coffee or food or these things.
You can disturb. There's nothing like that.
Yeah.
But in my experience, I feel yellowish teeth are more stronger than brighter teeth. You know, if you are making your teeth more brighter, means there are more chances that teeth will become sensitive and more brittle.
Yeah. You mean because over aggressive cleaning and all of that can really scrape off the...
No, the main purpose of the brushing is to keep the mouth clean.
I see. Yeah.
And flossing. Flossing also very important. You know, the thread to clean in between the teeth. Brushing only remove the outer surface, but we have sometimes the food can stuck in between the teeth, especially if you have some crowns or bridges.
Sometimes the cavities also can kind of, after placing cavities, some food can get stuck and start get these kind of problems also. Yeah. So water flossing, do you agree with this?
If you are more comfortable with that one, that's good. Water jet is there.
The water, okay. Yeah. So one last thing, as a yoga therapist, I've experienced myself the.
I'm a fan of yoga as well.
Okay.
You know that,
yes, I know that, and you do very good headstands, by the way. You should see him doing headstand.
Yeah.
Shrisasanas. Yeah. So I've experienced the TMJ pain due to grinding, and you would be able to tell us even better what causes this kind of grinding. Mostly, what I understand is that it's from stress, and from my experience after practicing yoga, it has reduced so much, but it didn't really eliminate the problem, but it was reduced that sometimes it almost disappeared. Yeah. So.
I agree with you. In fact, this grinding, it's an involuntary habit, especially happening during sleep. You know, we consider that as sleeping disorder, in fact. And as you told, it is really associated with stress, and it will make entire facial pain, especially we call this joint TMJ. TMJ. What happens when the people, they will clench the teeth, and some they grind also. So ultimately, what happens, there will be joint pain, and this pain can radiate entire.
Extend to the neck, to the shoulders, and even to the whole body.
So we will tell the patient to go for a stress relief lifestyle and go for deep sleep, and we have treatment as well, like night guard and all. But I think the yoga can help a lot in that situation.
Definitely. I've experienced that myself. Yeah, it cannot really eliminate the problem, because the problem is stress, and when it comes to stress, as long as we are alive, we cannot eliminate stress from our life. Stress will be there, but what we can do is we can manage it, we can reduce it, we can do as much as we can when it comes to self-care, healthy lifestyle, breathing techniques.
Breathing can reduce the anxiety as well. Definitely. The first thing you told, like some people are scared to go to the dentist. So immediately before going to the dentist, they can practice the breathing exercise.
Definitely.
It will make them more
integrating yoga with dentistry is something very helpful and very useful. And it was really nice to have this conversation with you. Thank you so much.
Thank you, Fatima. Thank you.